Well, the Eastern Cape is one of 4 provinces experiencing a surge in new COVID-19 infections. We speak now to Eastern Cape Premier Special Advisor Dr. Thobile Mbengashe. A very good afternoon to you, sir, and thank you very much for joining us. So what is the situation? Let's start perhaps more specifically with hospitals in that province.
Yeah, no, thank you very much. I think what we have noticed is that in the last 2 weeks, when we look at our average daily rates, we really substantially decreased. We've decreased hospital admission by about 51%. We used to have about 198 per day. Admission, we're around 131. But when you look at the actual dates now, in terms of admission, in the past week, we are just below 100 admissions per day. I think that's really positive in the way how things are happening, especially in Sarapatman and Nelson Mandela.
Some have described the situation in terms of health in that province as a crisis. Would you say that is an accurate description based on where you are right now?
Yeah, I think what usually happens is that you have the surge. Our biggest number was in November. We had about 32,000 people who actually got infection, and then we had almost around 200 number of people who were coming into the hospitals. Our system actually was very stressed, but it actually maintained and it was really resilient. If you recall that in the Eastern Cape alone, just in Nelson Mandela, we've got over 1,500 beds, and most of those beds were not actually filled. What really happened just before the minister came, there was really the allocation and the logistics and managing bed admission, especially in the casualties.
Do you have enough capacity where beds are concerned and ventilators are concerned?
Actually, I think the best way to really reflect that in terms of the capacities, in hospitals now we had just these last 7 days about 1,817 patients that were admitted. Out of those, we have, in terms of our hospital capacities for COVID, just about 4,000 beds and 420 ICU beds. The number of people who were admitted in ICU in terms of our system, there were about 154, and those who were in ventilators were 68. I think what's really important is that we are finding that in the private sector, there's a huge demand for ICU and critical care, and they were really stressed, and both in the Port Elizabeth and the PCM areas, where you saw the big pictures were actually people sitting in ambulances outside the private hospitals. We think we still have a lot of capacities, and we've been really working with them.
The Daily Dispatch is reporting today that hospitals in East London have no spare beds. What do you know about the situation there?
Actually, I think this is really one of the big challenges we have, is that there is probably more reliant in many of the people that actually report. I mean, just to give you a sense, at CMH we have about 10 ICU beds, another 13 ICU beds which we could activate when we need people. We have over 120 beds in Sicilian at Tuane, another 100 at Foy. Where we are finding is that the people are choosing where to go, and that choosing where to go, they're going to areas where there's an oversupply of demand in terms of going in the areas where there's capacities. What we need to do now, we need to combine the total bed situation in the province so that we can see and have visibility in the private, have visibility in the public, and we can actually show. So the capacity is there, but the use and the utilization and demand is really where there's a discrepancy.
So there isn't a problem in East London. There are sufficient beds. Is that what you're saying?
In the public sector, we have sufficient beds. I know that in private sector, they are very stressed, especially for ICU and critical care. I can admit to that.
In terms of essential service staff, are you well capacitated there?
What's really true now is that as COVID comes up, you really take away beds that are used for ordinary people and actually used for COVID. What is important is that in the many areas where we have to do, what is called elective work and elective surgeries, those have been delayed. In the past the past month, at the time when we had the lull, we already activated the idea of really going to a primary health care, making sure that HIV patients are done, making sure that all the people who need surgeries are done. Of course, the epidemic came up in October. But I think what we're really trying to do now is that we really try to create a surge capacities that also recognize that we still need to go and continue providing, critical care to our patients.
Dr. Mbengashe, you mentioned that public hospitals seem to be okay for now, and the problem might be with private hospitals. What is driving this? Is it a lack of space? To your knowledge, why is it that we're not seeing enough in private hospitals?
Yeah. What actually has happened really is that we are finding that many of the this new epidemic is very different from the other one, where we are finding very many young people who actually are coming in and getting infected. They are asymptomatic, they don't show signs. They go home and they meet with their parents and extended families. So when you do that, you tend to get the elder people with comorbidities actually getting infected. And these people, when they come up in very acute cases. But what then happens is that even the numbers that are very high, then the bed utilization space become very tight because the capacities cannot be dealt with until the surge time. So we are finding that many of the people who are actually coming up in the private sector are really elderly people with comorbidities who have severe diseases, and they actually require much more critical care and ICU beds. And that's driving the critical stress in the bed situation, both in public and private sector.
Thank you very much for your time this afternoon. And that was Mbengashe from the Eastern Cape Premier's. He's the Eastern Cape Premier's advisor, Dr. Thobile Mbengashe.